So with that, I will turn it over to Melinda.
Okay, thank you so much for that lovely introduction. And yes, it's fine to call me Mindy or Dr. Mindy. I kind of like that too. It sounds like a TV show that I might want to try to pilot. So I am thrilled to be with you all today, and I'm really looking forward to sharing more information on what we've learned about policy implementation, compliance, and enforcement over the years here on UK's campus, but then also as we've worked with other campuses across the nation. It's hard to believe, but we are actually gearing up to celebrate our 10-year policy anniversary this November. So I'm in the middle of convening a small subgroup that wants to help me plan a fun event there. So I'm hopeful that some of the information that I'll share today will be helpful as you all move forward throughout this process. Let's see. Well, it was working. It looks like I've lost control, Krista. Okay, there we go. So while our policy has been in effect for almost 10 years, I wanted to share kind of the ideal implementation timeline and then also discuss a few things that I think have helped us with sustainability and policy success. When we are working with other campuses, we try to recommend that campuses work on a 9 to 12-month implementation plan. And we know that that is not always feasible depending on when policies are passed or administration says, you need to implement this next week. But this is just kind of the ideal scenario and an example of a breakdown of the processes. And we did use a similar model there. So one of the things that I'll tell you is that we've used the same implementation process throughout the years. So although that diagram looked linear, it really is cyclical. And so I'm going to focus today a little bit more on phases 3 and 4. So one really important piece to the planning, implementation, and sustainability process is having the right people at the table. Let's see, sorry, it's going back. We can go ahead and move forward, Krista. You're helping me here. Sorry, we're having some technical difficulties. Thank you. So one of the most important things is to have the right people at the table, and having a formal committee with diverse stakeholders has really helped our process. 2 years ago, our ad hoc tobacco-free task force actually became a presidential appointed committee. And so I think this really helped to re-engage individuals across campus, to re-energize them, and to help continue with some of our sustainability efforts. We have bi-monthly larger group meetings, and then the opposite months we have subcommittees that we've reconvened that meet and or communicate. That's kind of up to the subcommittee. So our 3 subcommittees are communication and engagement, tobacco treatment, and compliance and enforcement. And all 3 of those remain integral to the success of our policy. But on the slide here, you can see an example of the different sectors across campus that we have engaged. And this has really remained consistent over the past, 12 years if you're including the planning process. But I really encourage you to think about who you have at the table and if they are decision makers. So one of the things that happened several years ago is people were sending representatives, and it was almost like, you had to go through 3 or 4 different channels or layers of communication. So if you have that decision maker at the table, it's going to make it a little bit more beneficial. Okay. And then also, as our committee was kind of reconvened or formalized, we developed a strategic plan. So we worked together, we had a retreat, and we really wanted to reinforce that the work of this committee is still important even years later. And so as many of you might be implementing your committee or initiating your committee, I hope that you'll consider doing this as you decide what your goals are for that committee and how you're helping to work towards not just policy implementation, but sustainability. And then on the next slide, you can see our goals. And okay, so with our goals, they're aligned with the 3Ts model, which I'm going to talk about shortly. And they also align with the subcommittees. So one, we just want to improve awareness and understanding of the policy, and that's among everyone that comes to our campus. So not just students and employees, but also thinking about contractors. We're a healthcare campus, so we also have patients, and then visitors. We have a lot of visitors come on both our healthcare and main campus. And then goal 2, we really wanted to have the importance of reducing the number of individuals on our campus who are using any tobacco product, and that aligns with our tobacco treatment. And then goal 3, improving compliance with an adequate enforcement of our policy. And that has been something that we've really, I guess I don't want to like to toot my own horn, but we've kind of led the way on testing out strategies. And so I'm happy to share what's worked and what hasn't worked. And we'll talk a little bit more about that shortly. In order to engage the committees, right? So you all probably sit on 17 committees, and I know that it's a lot, and sometimes it's hard to get people to follow up. So we started doing action plans, and this really helps the subcommittees to focus, try to improve accountability with what they're going to be responsible for that each semester and each academic year. And this has been really helpful with the communication loop as well. And then in addition to that, we initiated annual reports. And again, this is just helping with sustainability. And it also helps us to go back each year to kind of say, what did we accomplish? We can show the president that these are the things that we've been successful with. And then that also continues to provide support from our administrators that this is an important initiative. So I serve on all of the subcommittees. I'm currently the co-chair of our campus committee, but I would say that my role is to facilitate discussions between all 3 of the subcommittees and just make sure that everyone is in the loop. And then when we come back to our bi-monthly meetings, we report out and talk about how we can work together to achieve some of the goals set. So I probably don't need to mention this to you all, but I like to include this in all of my presentations. One huge word of wisdom is to not reinvent the wheel. So there are a lot of campuses that have implemented successful policies. There are existing resources out there, and you all are working with an amazing organization, so I know you have access to all of these resources and experts. But for model tobacco policies, we always recommend going to the Americans for Non-Smokers' Rights website. And so if you go onto this website, if you've never been, you can actually look at a draft policy and insert your campus language. And so it gives you a great starting point. I know when UK was actually working on policy language, this didn't exist, and that was actually before I came into the picture. But I heard that there were lots and lots of meetings where they were going around in circles on just adopting the policy language. So let's have at least a starting point. But the other thing is, if you adopt language that's consistent with the ANR website or model policy, it will ensure that you are included on their campus smoke-free and or tobacco-free list. And so we always want to see more campuses represented on that list. And just as a quick history lesson, so when we implemented our policy, like I said, this organization wasn't really doing tobacco-free policy, and they didn't have the criterion to be listed. And so we, like I said, drafted our policy. A lot of Kentucky campuses and even other national campuses copied our policy. And then we had to go and change some of our wording to just tweak it a little bit to make sure that we were still in alignment with ANR's guidelines. So while writing the policy is definitely important, I think that equally important is for campuses to consider and to articulate the goals of the policy. So what do you hope to accomplish by going smoke and or tobacco free? And while we know that the evidence supports many reasons to go tobacco free on campuses and on work sites, and some of those are listed here, what really fits within the values and strategic plan of your campus? And it's very different. And I've been fascinated as I've worked with other campuses where for some, they really want to focus on the environmental health approach. And for others, it's really that idea of overall and holistic well-being. And so you all know the pulse of your campus. And so you'll have, an opportunity to make sure that the goals of the policy do align with things that your campus is currently doing or wants to do. And this kind of goes along with branding the policy. So branding it is really important because you always want to be able to come back to that brand and or that policy goal. And that is very helpful when there's opposition, especially early on, but then also when people question your policy. And so, for example, on our campus, we've had people say, well, I work here, and so it's not really, I guess there should be designated areas so I can smoke when I want to smoke. And so then we can come back to our brand about we're creating a whole healthy place to live, work, and learn. So that's for everyone on our campus. And then I'll get to how we try to support those individuals who are using tobacco and who may be struggling. But we also, when we developed this brand, wanted it to be a very positive approach. And so, no finger shaking and telling people that are using tobacco that they are bad people. Obviously, we know that's not the case, but really think about how that brand is going to work for you. Okay, so I mentioned the 3 T's approach, and this is something that our campus used during the planning phase. We're still using it during the implementation phase 10 years later, and we use this when we're working with other campuses. So the 3 T's approach is really a 3-pronged approach focused on tell, treat, and train. And the idea is to create a culture of compliance and to reinforce that the policy is everyone's policy on their campus. So I'll go through these 3 T's. And there is an article if you're interested, and I'm happy to share that with the group. I can send a follow-up email. So the first T is tell, and this is really the communication of the policy. And while it sounds really simple, I have learned that there are a lot of checks and balances with communicating the policy. You want to make sure that it's occurring at multiple levels. You want to make sure that there's adequate signage. There's always a need to assess signage to determine if new signage is needed. Thinking about how you can integrate the message into any sort of events that your campus has, any sort of trainings, any materials that are distributed, now mostly online. But again, thinking about that brand and if you can reinforce that throughout. So we actually, it'll come later, sorry. But along with sharing that message is thinking about having a website. Most campuses find it really helpful, even if it's not some super fancy website. I would say that ours is not super fancy, but don't tell the UK web people that I said that. But at the same time, it allows individuals to have a place to go for policy clarification. We have information on our tobacco treatment resources. We also have information on our ambassador program, which I'll talk about here shortly. On our homepage, you can see that we have President Capilouto, the current president of UK's campus, and he does a short message just reinforcing the importance of the policy, what the policy is, and we found that having administrative support is very important, especially when it comes to employees and faculty members. So to have his presence there is fabulous. And then the other thing is just having an email perhaps or social media links and thinking about who's going to be in charge of the content, the updates, and who's going to potentially respond to emails that might come through about the policy. I will say that when I first started, Dr. Ellen Hahn, who really led the way here on UK's campus, she's amazing if you don't know her, but she was responding to lots and lots of emails. It was kind of, I took on that responsibility about 6 or 7 years ago, and so I'm the one that's kind of the contact person for all policy-related questions. So I mentioned communicating with incoming students and employees. When I first started, we used to distribute brochures and handouts and give out folders to all incoming students. We usually had about 6,000, and then all employees at the orientation that they're required to go to. Our university has since changed things up a bit, and so now they like to share everything virtually. So we actually, for faculty and employees, have a learning management system called Canvas, where they have access to, it's called a course shell, but in essence, it's a place they can go to with all sorts of university policy information and resources. We also are currently working on adding a web-based training orientation, and that's what the screenshot is that you're seeing right here. And we're trying to implement that for all incoming employees at least. We are also working on something similar with our healthcare employees, and then trying to get this integrated into some of the student education that they have to do for alcohol, EDU, and other substance use. We have a really small piece in all of those things, but we wanted to expand it a bit. So we're currently working on those modules. The one thing that I did want to mention is our students that are moving on campus, they have to sign actually a hard copy of a paper that says they understand all of the residence hall policies. And so 2 years ago, we were able to have something added related to the tobacco-free policy. So that was a great success. This is just an example of an index card that we had printed. It's about 3 by 4 inches. We have policy information, we have our brand, and on the flip side, which I'm sorry I did not include, but that has information on our tobacco treatment resources, as well as our website and our social media. So if you can create something really simple that you can hand out at events, hand out on campus, that is something that we have used quite a bit. And then this is just another version of our info card that our healthcare campus wanted to tailor a bit because they have so many patients and so many visitors. They wanted to ensure that the message was something that would resonate with them. And then this is a picture of a map that we used to put in our good old-fashioned brochures, which apparently are outdated now. But depending on the size of your campus, you might want to consider a map. And our map reinforces not only where our policy kind of university-owned property, which is all of the area and shaded in green, but we also designate where individuals can purchase low-cost nicotine replacement products. And that was a huge push from the university from the get-go, that they wanted to make sure that the availability of tobacco treatment and NRT was at the forefront of the conversation. One of the things that we like to reinforce is that we never tell people where they can go smoke or use tobacco, because that's usually the first question from visitors or patients. But we like to frame it as UK property ends at XYZ, so at whatever street that might be. So we don't want people to think that we have designated areas, and we also want to go back to the goal of our policy. So if you look at this map, you'll see some streets are in white, and those are actually city or state-owned streets. This is a little bit dated because we just got control over one huge street that ran right through the middle of campus. So that is going to be extremely helpful moving forward this year. But we also, if you go to our website, have an interactive map. And so that map updates automatically as soon as our property lines change, as soon as locations for NRT change. And so that's been really helpful, so we don't have to wait a whole year if something changes with the printed maps. but it was a great place to start. So signage you've probably already thought about, and here's an example of our sign as well as some of the partners that we've worked with. Again, just think about what individuals on your campus are going to be receptive to. You might start out with some portable signage to try to kind of test things. And so the signage we have right now is metal, and they're actually quite pricey. They're about $80 to $90 to replace one. And so we've been, our committee has been talking about how we might adapt. We also have these small circle clings. I'm sorry I didn't put a picture on there, but those are supposed to go on windows and doors. We recently were told by our campus architect that they do not like those. So we're now removing the 200 that we put up over the past couple of years. So one thing I would say is to talk to individuals on your campus who are in charge of signage. I know on UK's campus, having everything branded UK, making sure you have the updated logos, the font size, all that fun stuff I learned about was really important. So the other thing is we do have some spray paint decals on our sidewalks for our healthcare campus, and individuals seem to like those, but they don't want those on our main campus. So a lot to think about. And in terms of signage, so now we have a signage assessment that we do quarterly. And so we actually have a web-based system that we can track where all of our signs are. So when new buildings go up, we know that we have to put new signs up. We can also document if a sign is damaged. And then when we do our next quarterly assessment, we will replace that sign. The other thing I always like to mention is just the idea of removing smoking and tobacco use cues. There's not a one-size-fits-all approach, obviously, to this, but research has shown that cues like smoker poles, ashtrays, and similar things actually promote the use of tobacco. And we also know that these smoker poles encourage individuals to congregate in certain areas, but it does not necessarily mean that they will dispose of cigarette butts. Most individuals will light up as they're walking towards them. And unfortunately, a majority of the time people throw butts on the ground. We did an observational study here on our campus because our healthcare campus decided to put some of these up without our knowledge. And so we wanted to go back to them and say, look, these are not as effective as you think they might be. And we also have a student doing research that on a campus that has designated areas, and their campus has the most beautiful gazebos I've ever seen, but they are the designated smoking areas. And so he's finding with his research that these designated areas actually encourage social smoking and tobacco use, and they may actually lead to initiation among others on campus. So just something to think about as you're coming up with your plan. And then just a few other communication pieces. Take advantage of your PR and marketing folks, student media. We try and include a policy story that goes out to our entire university around Kick Butts Day, as well as the Great American Smokeout, and then any other tobacco prevention partnership that we have. And so that's been a helpful way to not only promote the policy, but also our tobacco treatment resources. And we do a lot of events. Starting out, events are really helpful to get the word out about the policy. And I would say we've learned over time, rather than just sharing policy information, make sure to partner with those who might be providing tobacco treatment, whether that's on your campus or in your community. And the other thing, we were way more likely to have individuals come up to our table if we had, you can see here, the little cards that says, I like my tobacco-free campus because, and then they could write why they like their tobacco-free campus. And then we would also take pictures and encourage sharing on social media. But that whole sense of empowering others on campus and reinforcing why the tobacco-free campus is important to them and that they also have a role in this policy, that seemed to really resonate with students especially. And my little video doesn't work, but down at the bottom of that slide, you'll see Scratch, and he's one of our mascots who's really popular. And so we got him to sign our tobacco-free banner, and that was a big ordeal, and people were very excited about that. The other way to get people to come to your table, giveaways. And so we were fortunate to be able to purchase some giveaways about 2 years ago. And students especially really seem to like these. And we're in the process of kind of rebranding where we'll have some new swag, which we're excited about this year. Okay, and then finally, just thinking about social media. You all are probably much better at social media than I am, but I am lucky to have college students working with me. And so they're the ones that have come up with our social media plan. We did a social media kit for our 5-year anniversary. We'll be doing something similar for our 10-year anniversary, where we share potential social media messages with campus partners and community partners so they can just copy and paste. And so having social media presence is really important, especially with youth and young adults. And so you might want to think about who could take this on for you in your campus. The other thing in terms of communication is just keeping up with the times. So while we still promote policy language, information, and tobacco treatment, we know on most campuses right now, e-cigarettes and Juuls, being a type of e-cigarette, are flooding the campus. So our ambassadors actually created this flyer that we now have at tabling events, and we can share with Greek Life and other student organizations. So it just reinforces that we have to keep up with the times and sometimes tweak the way we're talking about our policy. And this is not to overwhelm you, I promise, but if you asked me when I first started working on UK's tobacco-free policy several years ago, if I would still be doing all this follow-up, I would say no, but we are still doing lots of follow-up. You have to realize that there's so much turnover on campuses, people in positions that maybe shared your policy info before, but then a new person takes over and they don't know they're supposed to. So this is just kind of my cheat sheet of what I have to follow up on every month. And then in terms of communication, we did kind of extend a good neighbor policy to several of the residences and businesses that surround our campus. And so UK actually provided signage for our campus partners that wanted to go tobacco free at the same time we did, or anytime during that implementation phase. And this is just a template that I've taken from Tobacco Free Florida. Actually, they have a good letter that you might want to send out to your neighbors, and it's called the Good Neighbor Template. But it really did help when individuals realized UK was going tobacco free, and we're such a large campus, and so community members were worried that individuals were going to come to their property to use tobacco. And so this allowed us to give them the opportunity to go tobacco free with us, and many of them took us up on that offer. Okay, so that is the first T. I know that was a lot that I threw at you, but please know that you're always welcome to contact me if you have questions or if you want to see more examples. I have lots of them. So the second T is focused on treat. And we won't really talk about treatment much today, but I do want to reinforce the importance of it. If people can't manage their cravings and if they don't have support to quit when they're ready, they're not going to comply with the policy, and that really becomes an issue when it comes to the success of the policy. So we are very lucky here on UK's campus. We have the capacity to offer free nicotine replacement products and a variety of group or individual counseling options for employees and students. And if students or employees are enrolled in one of our tobacco treatment programs, they do receive the free nicotine replacement for up to 12 weeks, and that could potentially be renewed. So we are very lucky to have all of these partners focusing on tobacco treatment. As I mentioned, We do sell low-cost nicotine replacement. So for those who maybe aren't ready to quit or visitors, we want to let them know that we're here to help them manage their cravings. And we do offer gum and lozenges in our gift shops and our pharmacies. And we have a student Wildcat pantry that we're now selling those products as well. So just a really quick blurb about the success of our tobacco treatment. These data are older, but we did see a 4-fold increase in quit attempts over the first year that our policy was implemented. So I tell you that because you want to be prepared and have something in the works for tobacco treatment. So I'm happy to share additional details about the cost, and one of the things, we have great people in our healthcare system that help negotiate a very cheap cost for our NRT, and so we were able to negotiate from $47 to $17, and that was something that I had nothing to do with, but it was very important in being able to continue offering the tobacco treatment. So I would just encourage you all to think about how you're going to offer tobacco treatment, and if you can partner with existing campus resources, if you have healthcare facilities on your campus or off campus, if you, we have a great statewide program that we've partnered with. We also promote our 1-800-QUIT-NOW, our quit line, and so that's something that we make sure to provide to all of our employees and students as well. And then there are obviously national organizations that have existing programs, so just to think about what might work for your campus. All right, so finally I'm going to talk about the third T, which is train, which it tends to be the thing that people want to know the most about. So how do we focus on compliance and enforcement? So our third T, we really wanted it to be a sense of empowerment. So there's not one person on our campus that is responsible for compliance and enforcement, but everyone is. And so I always like to start out by talking about the difference between compliance and enforcement. So compliance is really the rate at which people conform or adhere to your policy. So are they following your policy? And what efforts are you taking to ensure that those on campus are adhering to the policy? And I'll talk about our compliance strategies. So enforcement is really the punitive or corrective actions that are or are not taken when the policy is violated. And so obviously these can be achieved through positive or negative reinforcement of certain behaviors, and that is very different across campuses. But a lot of times you'll hear people use the terms compliance and enforcement interchangeably, but they are a little bit different. So without clear messaging, so all the communication that we talked about earlier, consistency and policy awareness, and then a consequence of some sort, whether that's verbal, whether that's written, that's up to the campus. But the intention behind these tobacco-free policies has little effect on outcomes. So if a campus has a policy in writing, but they're not doing anything about it, then that campus is probably not going to have as much of success as a campus that has all of these things in place. And if you can focus on compliance and strategies to improve compliance, then there's actually less need for enforcement actions. Although you still should have a plan in place, you probably aren't going to have to go to that extreme level. The other thing is you should think about compliance and enforcement early in the planning process. Campuses a lot of times want to wait until they already have the policy, but this is when it becomes a bit more challenging. So on our campus, we have a group called Tobacco Free Take Action. This group is housed within our Tobacco Free Campus Committee. And it's really a broad team of employees and also students who are committed to improving compliance with the policy. This TFTA has progressed quite a bit since it was initiated in spring of 2011. And that's when I came on board as the director of TFTA. But we first started out with a campus-wide call. Who's interested in helping with Just double checking. Is that sound working okay? Okay. Great. Sorry, yeah, the TFTA progression, we then worked with public health nursing students, and while that was a great success, we learned that there wasn't sustainability to that approach. So we were able to leverage data that we collected from that process, and we hired 4 part-time ambassadors in spring of 2012. I currently have, gosh, how many do I have? 5 part-time ambassadors. So this process and this program has continued since spring of 2012. And I'll talk a little bit about how we're trying to build our capacity, but our goal is to kind of go back full circle where we want to recruit volunteers. We want to initiate a student organization now that we have the capacity with our part-time ambassadors. Okay. All right. So our ambassadors are trained in a variety of things and things that you would guess: how to approach violators. We've developed a scripting technique for them to do so. What happens if somebody doesn't comply? They do environmental scanning, which means they help with all the signage assessment. They do help with cigarette butt data collection, and that's just one means of data collection that we use to help look at policy compliance. They also are trained just in the general policy, campus boundaries, but then we also make sure they understand the addiction of tobacco and then the tobacco treatment resources we have on campus. So when we first started, we had a very condensed training. We learned that that was not enough to have ambassadors with high self-efficacy. So we have developed some self-paced online training modules, and we've actually worked with several other campuses to develop tailored training modules for their campuses, but we wanted to make sure that they felt very confident when they went on campus to approach violators. Here are some pictures of our ambassadors. So not only do they approach those violating the policy, but they promote awareness of the policy and the tobacco treatment resources. And I'll say that we used to have to beg to attend events, but now we can barely keep up with all of the requests because organizations across campus have realized that this is an important initiative and they want to support us. So just a really brief overview of what it takes. So I'm currently the supervisor of our 5 ambassadors. This falls under my service category to the university. And this is a challenge sometimes with other faculty responsibilities. So if you have somebody that is a staff member and they already have supervision of employees, then that might be a great designated person if you decide to go this route. One of the things that I'll say, I've tried to maximize my involvement with this, one, because I love it and I'm super passionate about it, but I've been able to do research on policy compliance and tobacco policy implementation. And then I also use all the information and lessons learned in my teaching. So I try to maximize my involvement as much as possible. And so that might be a win-win if you find a faculty member that has this interest and passion. So our ambassadors are paid hourly. We are currently allotted 1.5 FTE, which equals 60 hours. But we tend to not use that many hours over our Christmas and spring break and then during the summer. And other campuses have used a similar ambassador model, but they didn't have the funds to pay part-time staff. So they've opted for internship credit, volunteer or service hours. They've combined it with existing peer educators on staff and or collaborated with existing student organizations. So I would just say, don't feel like you can't do this if you don't have funds right now. There's a way to get started if you're interested. We have learned that it helps to have consistency and not turnover every semester. That helps with training and sustainability of our messaging. I've actually had 2 of my current ambassadors since they were freshmen, and they'll be seniors in the fall. And they've really been able to take on more of a leadership role and help train new ambassadors coming in. I did mention that we use something called scripting, and in short, this is really just making sure that the same language is being used no matter who we are approaching. And the ambassadors are required to demonstrate competence in scripting through observation, role play, and then I actually check them off before they're allowed to approach individuals on campus. And we also make sure that our ambassadors are always in pairs, so there is considerations for safety. And here's just an example of scripting. So if I see somebody on campus, I would just walk up to them in a very friendly manner, non-confrontational. I'm not shaking my finger at them. Hi, my name's Mindy, and I'm the co-chair of our Tobacco-Free Campus Committee at UK. Are you aware that our campus is tobacco-free? I ask you to please respect others on campus and put your cigarette out or whatever they have and dispose of it in a trash can. So if they comply, which that's what we want to happen, right? We always thank them, and then we try to reinforce the NRT product or tobacco treatment. And that's when we have our info cards that we can distribute. So that's a super easy scenario. And again, I'm happy to share our quick tip sheet if that might be of interest. We have some that aren't so easy. You know, not everybody complies, but the majority of people do actually comply if approached in a friendly manner. And then we've also adapted our scripting based on some of the e-cigarette issues that we have on campus. And while it's a very similar approach, we just have scenarios on how our ambassadors might answer questions that come up. So people always want to know, does it work? And so the researcher in me can say, yes, it works. But I think it's important to reinforce that the whole 3Ts model is happening on our campus. And so that's what really leads to some of our successful outcomes. So this just shows some of our cigarette butt data. We collect cigarette butt data now once a year. We used to do it twice a semester, but we look at campus hotspots that are frequented by students and or employees. And so you can see a dramatic decrease. The first year that we had the ambassador program in place, we had a 40% improvement in compliance related to cigarette butt debris. And we have a whole protocol that we use. And again, I'm happy to share this. We have updated our protocol now that we have more e-cigarette and dual use on campus. So we're also counting discarded pods. But in addition to the butt data, we also collect observational data. So when the ambassadors are out there, they are documenting how many observed violations they've seen, how many people they've been able to approach, and then also how individuals responded. So we have that for all of our hotspots as well. And here you will see that the majority of people do actually comply, and there's a positive response. And by positive response, that doesn't necessarily mean they're hugging you and saying thank you for approaching me, but they go on with their day. So they comply and then they walk away. We've only really had very few negative responses in which people, you have to ask them several times or they get a little defiant. One of the biggest training pieces is I don't want my ambassadors to be in harm's way. So if they ever feel unsafe or uncomfortable, they have our security officer's number on speed dial and they can just walk away from that situation. We do have, like I mentioned, a couple of articles, and I'm happy to share these as well, but that talks about our process that we've used to collect data, and then also a little bit more about our ambassador program. And so I know I'm running out of time, so I'm gonna go through the next few quickly. But another compliance measure that we use is a report line. And so when we first started out, we had an email-based report line that you'll see here, but we also now have a web-based form, and here's a screenshot of our web-based form. The reason we did that is through the email system, we were getting mostly general complaints or just random things that people would say about the policy, where this online violation report form asks for very specific information. And this can be used to help me send out our ambassadors to certain areas, or we look at signage in those areas, or we can reinforce that this was not necessarily UK property. And it's really been helpful in our process. I am responsible for responding to these and documenting these, so that's something else you might want to think about. And then in terms of enforcement, so one of the biggest suggestions I have is to integrate your enforcement into existing policies, existing corrective action. There's no need to reinvent the wheel. And what we learned from tobacco users that participated in some of our focus groups is that they didn't want to be treated differently, and they shouldn't be treated differently if they were violating a policy versus someone else who used alcohol on campus or marijuana or you know, just did something else against our code of conduct. So all of our corrective action policies are built into these existing mechanisms. So for employees, all of that goes to HR. There's actually a 7-step process if people are observed violating or if we're able to follow up with them. Part of that always relates to not making them go to tobacco treatment, but letting them know that it's available. For students, it all relates to our code of conduct, and that depends on what our dean of students is doing at the time. So that's something that is then consistent with other policies. Making sure that you have the policy and you have something about it for vendors and contractors, having somebody on your committee that is responsible for those contracts, but that is also responsible for follow-up if there's an issue. And we have a wonderful person on our committee that I know I can email and say, this construction site, we had some folks using tobacco that were their employees. Can you please follow up? And I know it's handled. And so that has been extremely beneficial over the past 3 years since he's joined our team. And then just in terms of thinking about sustainability, I briefly mentioned this, but our ambassadors decided they wanted to create a student organization. And so that is something that they're working on. And while we are going to be able to use this opportunity to promote the policy, compliance, and awareness, we'll also be engaging young adults in tobacco advocacy efforts on campus and then across the state and community. And this is something that they're really excited about. And this is something they're doing on their own time as well. And so finally, just to wrap up, I would encourage you to use your networks. We did develop a network called Go Tobacco Free because we were receiving so many requests on what we've done at UK and to share lessons learned. And if you're interested in being added to the listserv, you are welcome to email me, and then there's the link, and I'm happy to share those via email as well.
I'm okay to do, if we are, then we are, that's cool, that's great. If we're not, then I'm gonna run some errands.
And this is just a wrap up. So a few take home messages. Change takes time, be patient, be persistent, focus on those positives that you're accomplishing. Think about who to partner with because it's really a necessity for success. That communication piece is vital. Make sure you're thinking about and talking about compliance and enforcement now. And obviously support is available. You all have one another, and you have your great grant, your grant organization as well, and you're welcome to reach out to me. But I'm very excited to hear if you have any questions, and I appreciate your time.
Thank you so much, Mindy. That was a fantastic presentation. I love the 3 T's approach. You gave us really great ideas for how to communicate the new policy, and that you have to communicate, as you said, in so many different ways. I really liked the idea of the spray paint decals, and I think that's an awesome activity for students to do. And just a note with signage for our grantees, as Mindy was saying, some of those metal signs can be quite costly. They're $80 to $90 each. And just remember that you have grant funds to support this, which is really great news. The fact that tobacco treatment is a part of the plan is so important. And I think we often think of working on cessation once the policy passes and you're implementing it, but I would really encourage all of the grantees to start promoting resources early on. It makes the policy so much more palatable to folks when they know when they're ready to quit, they know where they can go to get help. And it was really encouraging, Mindy, to just see that jump in folks who were wanting help to quit tobacco, that it was really, the policy was really spurring them to make a change in their life.